You can start in 10 seconds. Yeah, hearing that. Start.
Namaste. Greetings from the World Breastfeeding Week celebration. And as you all know, August 1st to August 7th, we celebrate the World Breastfeeding Week worldwide. I, Pooja Marathe, a pediatric nutritionist and a lactation expert, brings to you the best topic which we can ever discuss, that is starting early breastfeeding, that is first within 24 hours. I take this opportunity to thank the viewers who are joining me live and who want to understand on why this is a very important topic. When we say that the mother is about to deliver or is going to have a delivery, whether it's a normal vaginal delivery or a C-section, we also understand that she needs to be prepped for a beautiful journey called as breastfeeding. Breastfeeding is nothing but putting the baby to the mother's breast post delivery. Now, there are some case scenarios wherein the baby is a term baby, is healthy, breathing on its own, and can be put to the breast on the mother's chest, even if the delivery is by a normal vaginal delivery or via a C section. This early initiation, or what we call it as the golden hour, allows the baby to be latched onto the mother's breast and kept with the mother, giving a comfort to the mother and the baby. The first 24 hours of breastfeeding goes very importantly if it's in the first step. As I mentioned to you, the baby's weight could be between 2.5 to 3.5 or beyond that as per the Indian standard pediatric norms. Second, the baby is a term baby, that is post 37 weeks. The baby is informed by the pediatrician that yes, the baby can be shifted to a mother's side, and definitely the mother is antenatally counseled about breastfeeding. Four criteria of fulfillment of making sure that the baby is put to the chest of the mother allows the baby's sucking to start. So when we put the baby in the first place, the baby gradually starts, suckling it in this manner, and the baby is comfortably able to draw cholesterol. Cholesterol is a thick goldenish color liquid which is coming out of the nipples as soon as the baby is put. This is because of the oxytocin hormone which is released by the mother and the prolactin hormone which is making the milk. So as soon as the baby is brought to the mother's chest, the mother feels calm and she is quiet and she is holding the baby and she is allowing the baby to breastfeed. So early initiation has many benefits. Number one, frequent latching, that is within 1.5 hours or 2 hours. The first feed, the transfer of cholesterol allows to build immunity. One drop of cholesterol, 5 ml of cholesterol, 10 ml of cholesterol depends on how the mother's milk production has been initiated. We have a very beautiful concept called as skin to skin contact, as in the baby is put to the mother's chest and the mother is allowed to hold the baby for minimum 20 minutes. Maximum it can be for an hour or two. Mother's recovery will be much better if the baby and the mother are put together. On an international background, on a platform, we call this also for this concept of IKMC, that is immediate KMC, during the time of delivery. This allows the mother to settle down. This allows the baby to settle down. This allows the baby to be held emotionally, allows the mother to relax and then move ahead with one thing important, that is direct breastfeeding. There are a few conditions where the babies cannot be directly breastfed in the first 24 hours. It could be an emergency delivery where the baby is in distress and shifted to our ICU. It could be a preterm delivery where the baby's weight is not supported and baby is born before 37 weeks. There could be another scenario where the mother is not able to keep her health in a good place. She might be having uncontrolled preeclampsia, she might be having uncontrolled diabetes. So during these emergency cases, what we need to do is we need to understand that once the baby is shifted to the NICU or is shifted to the room side, stabilizing the mother and helping the mother understand that yes, she can at least start hand expression of cholesterol, which will help the baby and the mother bring together. So in that first 24 hours, many things are happening around. The mother is trying to recover. She is trying to stay hydrated. She is able to feed the child. She is able to get up on her own with support from her people, from her family members. She is recovering. So it's a fragile emotional state, it's a mental well being, and during this process, we are expecting that she needs to start feeding the baby. But at a given point of time, the energy levels between the mother and the child can be different. During the first 24 hours, the child is awake for maximum 3 to 4 hours, and after which the child sleeps for a longer period of time. And usually the mothers come and say that my child is not getting up or is sleeping for a longer period of time, and that is the reason I am not able to breastfeed. Well, to all the first time moms or the second time moms, this is a very important question that you raise, how do we wake up our child? We don't have to literally shake the baby. We don't have to really swaddle the baby. What we need to do is we need to put the baby in this manner, hold the baby with composure, and look at the baby and help the baby by, holding the hands, a little tickle on the leg, a tickle near the ear, which will allow the baby to start waking up. Also, if you have seen that from the first feed to the second feed, the time is above 2 hours, the baby starts giving you early hunger cues. Now, early hunger cues is a form of communication given by the child. Now, this is a very important aspect that every parent or every caregiver should be informed about and should know about it for two basic reasons. If the child is, showing a good expression of turning the neck towards the left side or the right side, opening the mouth, putting his hands inside the mouth, these are the early hunger cues. During this time, if you pick the baby up and position the baby, early latching is very, very possible. If it's a mid hunger cue where the baby is putting his hand inside the mouth, moving, tossing his neck more frequently, crying in a short duration, and then is getting a little red, this is what we call as a mid hunger cue. Now it becomes a little stressful for the mother because she is trying to position herself. She is trying to wake up. She is dependent on a family member to give her the baby. These things can be identified and help the baby to calm down. Always understand when a baby is in a late phase of hunger, which is extreme pride, when the baby goes red, the baby is very hungry but still not able to control his hunger. At that point of time, you need to talk to the baby, you need to swaddle the baby, you need to understand that you need to calm the baby down. You can put the baby in this one manner, hold the baby for some time, and then you can offer the breast. These points are very important for the first 24 hours because the circadian rhythm, as in the baby's sleep cycle, is very different to the mother's sleep cycle. During the day, most of the mothers would tell an excuse of not to feed the baby because the baby is sleeping for morning times and the baby is awake during the night. This is definitely bound to happen for two reasons. When the baby is in the mother's womb, the womb is a darker place and the baby is active during the specific times. But when the baby is out of the mother's body and is surviving, adapting to the external environment, the baby is taking time to adapt and learn the process of how to go about feeding. Second thing is keeping the baby warm is also very necessary. So if you have double wrapped the baby, you have kept it in a swaddle, the baby feels secure. And that is the reason the babies do not come for, feeding on time. But if we unwrap the baby, put them on the table, and then slowly we unwrap them, undress them, they start feeling insecure because the temperatures have dropped down, and that is the reason at that point of time the babies will be awake. When we have these early hunger cues being taken into consideration, the first 24 hours feeding during the day is quite possible. Second thing, what I want to talk to you about is latching. Now, when we are latching, we need to understand that the hold of the breast plays an important role, and placing the breast on the baby's side also plays an important role. So, I'm going to demonstrate to you with a breast model, a mouth model, and the doll that I have. So, when we are holding the breast, we have to understand we do it in a C shape. So the thumb is up and the forefingers are down, and you are compressing from one side and allowing the baby to take the breast in this manner, nose to nipple. When you are aligning towards nose to nipple, the sliding of the breast inside the baby's mouth is going to be easier, and the baby will be taking a part of the areola, and the nipple will be placed in the hard and soft palate junction. So the nipple will be placed here. And if you can see, the areola is not seen. That is what we call as a technique known as deep latching technique. Initially, mothers may find it a little difficult to grab the entire part of the breast and place it. So, a trick over here is to hold your baby closer to yourself in this cradle pose where the head is on the arm and not on the elbow joint. The head is on the arm. The lower hand of the baby is below. The baby is in a 180-degree position and the baby is being touched to the mother's chest. So this skin to skin contact and this position known as cradle position allows the mother and comfort. But have you ever wondered that if a mother who's just had a C-section, can she do this position? Well, truly, if she has the energy and she has had a second baby or the third baby, she will definitely go for it. But what for a first time mom who has just come out of the operation theater and we have to breastfeed her? So there is a very beautiful position known as the laid back feeding, where the baby is kept on the mother's breast with the help of sisters or the lactation consultant, and the baby is kept on top of the mother. This way, the mother's breast is compressed and then the baby starts latching. The baby finds its way and opens the mouth in a angle of the angle of lips is greater than 140 degrees. If the angle of lips is lesser than 140 degrees, the baby will only be suckling on the nipple. And the next day, the mother will be complaining milk is not coming in. For an effective latch, positioning the baby on the breast is a very important. Second thing what we understand is even if the mother is not able to wake up, a laid back feeding position in this manner or the baby is kept in a horizontal position allows the mother to be comfortable. She cannot be, in a negative state of mind that I'm not going to breastfeed. Your child does require cholesterol, and the quantity of cholesterol for the first 24 hours would be within a range of 5 ml to 10 ml. So as the latching advances, the cholesterol intake is going to increase. Also, most mothers in the first 24 hours probably may not understand the importance of night feeding because the baby is crying continuously. Every cry is not hunger, and every cry doesn't mean that the baby is hungry. Feeding the baby in excess to put the baby down is a wrong practice where most of the family members fall. So, based on the hunger cue feeding, every 2 hour feeding, getting the baby to the breast allows the mother's prolactin levels to go higher, which allows the next day milk production to be better. Now, whether you are doing a laid back feeding, whether you are doing a cradle hold, or whether you are doing a sideline feeding, this gives a confidence to the mother. It makes sure that the mother and baby are together. And third, importantly, they are being able to ruin, which is one of the principles of baby friendly hospital initiatives. Please also understand that a family support, whether it could be a husband, a mother in law, a sister in law, or a sister, can encourage more towards breastfeeding and latching in the first 24 hours. If this is taken care when the baby is near the mother's side, then it becomes easy for the mother and the baby to have the norms of exclusive breastfeeding as recommended by WHO and UNICEF. Now let us look at the scenario number 2, where the mother has delivered but the baby goes to the NICU due to the criteria reasons of baby being premature, baby having respiratory distress, baby's weight is not supported, or the mother's maternal conditions are unsupported. So when we have these criteria in the first 24 hours, the baby and mother separation anxiety increases, and that brings up on an emotional burden. In this situation, when a lactation consultant goes to visit the mother, or the trained lactation nurse goes and talks first with the mother, she mentions about two things. One is hand expression of cholesterol, and second is adequate hydration. Both things are equally important, and we understand that hand expression requires a lot of energy. So, when a lactation nurse or a counselor goes towards the mother's side and helps her for helping her understand regarding expressing with the hand first in the first 24 hours, it makes the job easy for the family members. As we start expressing cholesterol, it can be collected in the container and it can be secured in a syringe or a container and can be given to the NICU. As early as possible, this cholesterol gets put on the buccal cavity of the child's cheek, and easy absorption of cholesterol helps for immunoglobulins, probiotics, preterm proteins to get absorbed into the intestine. What we call them also as human oligosaccharides, HMOs, which is very, very essential for the gut microflora to be enhanced, allows the baby to come out of the stress. So, first 24 hours cholesterol painting or cholesterol lacing to the baby's buccal cavity plays an extreme important role. Secondly, it allows the mother to calm down. It gives her a lot of confidence. It helps her to bridge the emotional bond. It allows her to initiate pumping. So, I would also like to stress upon a point over here. According to the international laws, pumping can be initiated within the first 6 hours if the mother is antenatally prepared for breastfeeding. It can be a manual pump, it could be an electric pump, that is a choice of a mother. But within 6 hours, she can initiate pumping, and that will help her to have a good milk expression. If you're staying in a hospital which has a hospital grade pump, you can also use the hospital grade pump for pumping it. The earlier the better, which allows the milk production to get stimulated and help the baby to calm down. So overall, I would like to suggest and I would like to tell that the first 24 hours plays a crucial role for both mother and baby. To conclude, I would like to say that from the mother's point of view, early hand expression, early pumping, adequate hydration, giving the mother an adequate mental rest with the support of the family allows early colostrum expression, especially at night when the prolactin levels are high. If the baby is on the mother's side, as we discussed, the laid back feeding, the help of a trained lactation nurse and a counselor who guides the mother for feeding. Also, putting the baby to rest, latching with a deep latching technique, holding the baby with a lot of comfort allows the baby to have a bond set together. So, if antenatal breastfeeding counseling sessions are being attended, most of the breastfeeding problems get resolved during that time because you are educated and you know the next process. If you are a first time mom, you are experiencing a whole new uh, era of motherhood. Or if you're a second time or a third time mom, you are prepared from your previous journey. But let me tell you, all journeys are never the same. Every pregnancy has its own story and every birthing has its own story. To conclude, I would like to suggest and would pass on a message stating that not only during World Breastfeeding Week, but any point of time you feel, uh, why me? Because your baby has chosen you. So breastfeeding is the best for your baby. Breastfeeding doesn't have any alternative because as if we follow the nature's rule, even our nature lovers or animals do not have a different choice. They also choose mother feeding. So why are we making it another choice? So given the fact that breast is best for the baby, I would like to conclude that please choose breastfeeding, and it's not difficult in the first 24 hours. There are many myths surrounded it. Let's break them, seek a counselor's help, seek a professional's help who is trained in lactation. Thank you for your lovely time, and if you have any questions, you can address it. I will be taking these questions live. So I'm open for any questions out of here. One second. Questions. Like, so we have a first question over here. What are the some common challenges a mother faces while breastfeeding and how can we overcome them? Number one challenge will be that she is not able to get up from her bed. Secondly, she is not being supported for breastfeeding. Her physical recovery has not happened in the way she has been making progress. So these can be the challenges. And to overcome these challenges is even if the baby is shifted to the mother's side, one thing we can do is hand express the colostrum and or start early pumping. And that will help in early initiation of mothers. Second question we have is, how can working mothers manage breastfeeding or pumping once they return back to work? This is a very great question because uh, many mothers have a 6 months maternity leave. So they have to resume back to working. Some of them also start early complementary period. So if according to the maternity law 2017, which is revised at, the first thing is that you need to speak with your HR and understand that if there is a breastfeeding separate place for pumping. Secondly, she can carry her electric pump to her place. If she is really into continuing breastfeeding, she can write a letter to the HR department, seek permission from her managers and her bosses, and then keep this confidential. And then she can take a break of 15 to 20 minutes. Our Indian laws do support these acts. So it's not very shameful of asking for a permission to pump for mother's milk. So these laws, if they are followed at workplace, definitely she can continue pumping and express breastfeed can be given to the baby. Our third question is, how can a mother know if the baby is getting enough? Now, initially, when the baby and mother are kept together, it works on a every 2 hour feeding rule, latching the baby adequately, helping the baby to follow the suck, swallow, breathe rhythm, and also allowing the baby to be calm on the mother's chest, allows the demand and supply to be met. Please understand, in the initial 1 week of time, more the number of times a month baby is latched to the mother's breast, the milk quantity is going to slowly increase. The first 3 to 4 days, this is going to be cholesterol, then transient milk, and then mature milk. Many mothers have the idea that from first day itself, white color milk will be coming. Absolutely not. The quantity is designed as per the baby's requirements. So first day it will be around 5 to 7 ml per feed. Second day it will be around 15 to 20 ml per feed. Third day it will be around 20 to 25 ml per feed. As the baby latches, the milk quantity increases. But if the baby is not latched, not put to the breast, then the milk will not come and she may have a problem which is known as engorgement. That's a different issue that needs to be tackled. The last question over here which says, can I mix breastfeeding and formula and how it will affect my milk supply? Well, in a few places, formula introduction, if it is happening, it is with consent. Parents need to be signing a consent for formula introduction. Secondly, if there is no rooming in, mother is kept in the recovery room and baby is shifted towards the mother's side, there could be a difference of 6 to 8 hours and the baby has not latched on the mother's side. At that point of time, formula needs to be introduced, or if the mother is in the IC. Third thing is that mixing breastfeed and formula is never recommended because the components of mother's feed are very different and they keep changing according to the mother's intake. Whereas the content in the formula come with an expiry date and they have a shelf life. They do not change over a period of time. So it is always best to choose mother's feed over formula, and definitely we cannot mix them together. So these were the questions, and I thank you all the viewers and supporters for joining us on this session. And I hope I have addressed your concern. This is Pooja Marathe signing off from KIMS Cuddles. Thank you.